Good morning. It's June 26, 2021. I'm Bob Tomic, Chair of the Surrey Prostate Cancer Support Group. We're pleased today to have a guest speaker to tell his journey with prostate cancer. Gogs started his journey with prostate cancer not many years ago and documented his day-to-day life with the cancer. He felt he could be a benefit to tell others on his path he took and decided to write a book named Prostate Cancer Strikes, Navigate the Storm. His book has been sold in many countries and he has received great reviews in the telling of his story. Lisa Johnson has written, with positivity, inspiration, humor, clarity, Gogs shares his own very personal journey with prostate cancer, from his first being diagnosed to treatment options, to surgery, and to what life looks like today for him. He has received reviews from the United States and the Focal Therapy Clinic in Oxfordshire, England, on his writings, which include many articles such as Prostate Cancer and the Importance of Regular Exercise, Prostate Cancer and My Coping Mechanism. I'd like you to invite with me Gogs. We look forward to your presentation. Thank you.
Oh, thank you, Bob. Thank you for the introduction. So once again, my name is Gogs Gagnon, and I was diagnosed with prostate cancer when I was 57 years old. Now, it was quite shocking and devastating to hear the news. I was quite active and fit at the time. I rode my bike to and from work every day. I was in the gym 4 or 5 days a week, and I also trained in the martial arts. So very fit, active, and having a cancer diagnosis was certainly not on the radar, and it really hit me out of the blue. And I'd like to tell you how I was diagnosed. Basically, when I was around 50 years old, my doctor recommended that I have annual physicals. And being active and fit, I thought that was a great idea. Head to toe, full blood work, everything they have to offer. And so I started having annual physicals. And at one of my annual physicals, my doctor recommended to include the PSA test. Now, I was getting a bunch of blood work anyway for other measurements, so I thought that sounds like a great idea. Let's throw that in there as well. So off to the lab I went with my requisition for blood work, and they took out some vials, and as per normal. And about a week later, I was in the doctor's office to review all the results, and as per usual, all the results were wonderful. Everything was in normal optimum range, and he was quite happy with everything except for one exception, and that was my PSA. It was slightly elevated. Now, he wasn't overly concerned. He said, it's your very first test. So what he did is he did a digital rectal exam, and he told me that my prostate was nice and smooth. He said it was enlarged, but he said that's typical as men age. Prostate's usually also enlarged when men age, so he wasn't very concerned. And he said there might be some other reasons why your PSA might be slightly elevated. He said recent sexual activity might be one. And so I looked at him and I said, well, you got it right there, Doc, that must be the answer. So he recommended that I have another PSA test in 3 months and hold off on any sexual activity a few days before the test. And I thought that was fair. So off I went. 3 months later, had another PSA test, and the results were even higher. So I was back in his office. He did another digital rectal exam, and this time he was a lot more. He took a lot more time, but he didn't feel anything. He said, "Yeah, everything really issue, nothing to be concerned about." So he said, "Why don't we just do your PSA test again in 3 months?" So I said, "Okay." I was starting to get a little concerned. 3 months later, my PSA is up even higher. So now my doctor's a little worried, and he recommended that I see a urologist and talk more about this PSA. And so about a month later, off to the urologist, and he asked me a ton of questions, all kinds of health-related questions, and I had absolutely no symptoms of any kind. I was sleeping through the night. I had no trouble with erections. I had no trouble urinary control. Just no symptoms, no family history. And so he did a digital rectal exam, and he confirmed the same thing my doctor said. your prostate's enlarged, but that's probably typical, but nice and smooth, healthy, and not even really concerned about it. So he recommended I have another PSA test in 3 months. Okay, so I started getting a little worried. Anyway, I had another PSA test in 3 months, and my results are higher. They keep going up. So this time, the urologist recommended that I have a prostate biopsy. Now, that's when you get, really concerned. You start doing Googling and asking your friends and kind of trying to learn what's going on. So I went in for this prostate biopsy, and the results came back negative. No cancer. So I was quite relieved. But I made an assumption. I assumed a few things. I assumed that a negative prostate biopsy meant you didn't have cancer. I never once thought that perhaps they could just miss it. So what had happened is I was no longer concerned. I wasn't worried. I thought, yeah, everything's great. Maybe that PSA is normal for me. Everyone's a little different. But I'm quite grateful that my regular doctor, recommended that I continue with the PSA testing anyways. And rather than just annually, because of my history of it rising, he said, well, how about every 6 months? And we'll just kind of play it by ear and see how it goes. And I thought, okay, let's monitor it. That's a good idea. So we did monitor it for several years. As a matter of fact, 5 years. And every reading was higher. Within 5 years, I had my PSA measured 14 times. In every case, it was higher. And by this time, 5 years later, my wife and I had moved to another city, so we had to find new doctors. So I was at my new doctor having my annual physical, and she had noticed that my PSA had been rising for a number of years, and she was quite concerned. So she did a digital rectal exam, and she confirmed the same thing, and nice and smooth, healthy, enlarged, but that's probably okay. So she recommended that I see a urologist, and so I found a new urologist, or she found me a new urologist, and he looked at my history, and he said, because you've had a negative prostate biopsy, I think you might like to consider an MRI. And I knew what an MRI was, but I didn't realize how important it was. So I went in for an MRI, very simple procedure, about 45 minutes, I guess. The image produces a nice three-dimensional picture of your prostate where the doctor can put it up on the screen and rotate it and have a look at it. And the results came back. I had a significant anomaly, not just a little anomaly. It was significant. It was huge. And it was outside the reach of the digital rectal exam. And that's something else that I took for granted. I assumed that when the doctor, a number of doctors had told me that my prostate was nice and smooth, I assumed that they meant my entire prostate was nice and smooth. I didn't realize that they couldn't examine the entire prostate. So the only, I guess, not really good news, but the only news about that is cancer normally starts, prostate cancer normally starts in an area where the doctor can examine. Mine was a more rare case where it was in another zone and it was completely out of reach, and it was significant, and it was a high suspect of high-grade cancer. So that's when I got the devastating news in my new urologist's office, and I completely shut down. After I heard the word cancer, I could no longer process anything he had to say. I'm sure he kept talking, but I already had went to a dark place. I already thought that my life was over, and this was it. And it was just a crushing blow. But looking back on that experience, I'd just like to point out that I really overreacted because I didn't even know my Gleason score. I didn't realize there was more tests involved. And I didn't realize there was many different options to consider, and there was more doctors to speak to. And here I was already assuming the worst without all this information. So basically I was in shock, and I didn't know I was in shock, but I was in shock. And not only did I go to this dark place, but I immediately had this urge to get rid of it. And I jumped to surgery, And even my urologist told me to slow down. He says, we can't make any decisions yet. We don't even know if it's confined to the prostate. There's still bone scan, CT scan, there's still a number of things. Plus, I want you to see a radiation oncologist, and there's a number of things to consider. So let's just gather all the facts and make the best informed decision as possible before, jumping. But I think I already subconsciously made that decision. So I agreed to slow down, but I think in the back of my mind, I already had made that decision. So what I had learned from that experience is when you're in shock, it's certainly not a good idea to make decisions. What I really needed at that time was time just to process the fact that I had prostate cancer. So I probably needed at least a few days or a few weeks even, just to learn to accept it before making decisions. So it's something that I had learned. So basically I went in for my bone scan and my CT scan, and they both had indicated that the cancer was contained. So with that, I didn't follow my urologist's advice. He wanted me to visit the BC Cancer Clinic in Victoria. He wanted me to speak to a radiation oncologist, but I kind of glossed over that. I did do a ton of research, and I do mean a ton of research. I probably read at least 40, 50 books on prostate cancer, and went through the Google like crazy. But I think I was biased. Even though I did read radiation, about radiation and HIFU, and there's so many options. I read them all, but I think I was a little biased, so I wasn't really as open as I should have been. So I really want anyone who's facing a life-altering decision to really make an informed decision. And the only way to do that is it takes time. And I understand what it's like to get a cancer diagnosis, and I understand what it's like to have this urgent need or feeling to get rid of it. So after I heard the news that my bone and CT scan indicated the results were contained, I contacted my urologist and I said, okay, let's go with surgery. And he gave me a couple more outs, and he said that, he says, okay, I'll schedule you for surgery, but I want you to know that you can change your mind. Even on the day of surgery, even before you come into the operating room, if you want to say no, please, you have that right. And so I said, no, that's what I want to do. And I was already headstrong on it. So I went and had my surgery. And now I knew about potential side effects. I knew about urinary incontinence, and I knew about erectile dysfunction. And I had spoke to my urologist in length about that. And I did a lot of research on that as well. And the doctor had told me that basically there's these two, for erections, there's these two bundle of nerves that run along each side of the prostate, and they're actually connected under a small layer of skin. So the doctor will attempt to save or spare those nerves, but he told me he couldn't guarantee that because he had to make sure they weren't invaded with cancer already. Because the goal of surgery, there's three goals of surgery. One is remove the cancer. Number two, preserve the urinary control, and three, maintain erectile function. In that order, meaning both urinary control and erections will be sacrificed in order to get the cancer out, because cancer is number one to get rid of. So he said he will look at my nerves, and if they look healthy, and if they look like they're not invaded with cancer, then he'll spare them, but otherwise he will take them out. So I accepted the risk, and that's something else that's very important too, is not only do you want to do your research, you want to make sure you understand the potential risks that you get into before you accept them, and make sure you can live with them. So I accepted, and here I was. I had my surgery, and I was waking up I remember waking up in the recovery room, and I was very anxious to speak to the doctor. I wanted to know, the first question I had for him, he comes in to see how I'm doing. And my first question was, did you save my erection nerves? My first question. I didn't ask him, how did the surgery go? Were there any complications? Were you able to get all the cancer out? No, those weren't on my mind. And he had told me that, yes, he said my erection nerves, they looked healthy. So he did spare them, but he did warn me. He said, even though they're there, he had to manually move them or peel them from the prostate, and they can get traumatized, bruised, damaged, and it may take several months or several years, or they may just never work again, even though they're still there. They just might become dormant. So I was happy to know they were there, but so a little anxious on recovery, how that would go. So I ended up spending 2 nights in the hospital, and I had the catheter for 14 days. Now that's a little longer than usual, and that's because of my fault. As I said earlier, I was fit and healthy, and I wanted to get back into my regular routine. And it's so important to follow doctor's advice. And when it comes to recovery, no matter what treatment option you choose, there's going to be some form of recovery. And whatever those recovery instructions are, you should follow them. So for me, for surgery, it was no activity for 6 weeks, basically. No lifting more than 5 pounds, and there was a whole list of things. But of course, I started to do too much, and I ended up fainting. And my wife had called 911, and it was kind of all a blur to me. I remember these 2 husky, burly young men coming in and asking me questions, taking my vitals, and they took me to emergency. And it turns out I just overdid it. And as a result, my urologist recommended that I keep the catheter a little extra in case. And it's so important not only to follow the recovery. The reason why you want to follow the recovery is you're healing through treatment, and the catheter has a job to do, and the urethra has been cut and reconnected to the bladder, and there's stitches, and it needs time to heal. And if you put extra pressure on that, you could tear a suture, or you know, all kinds of damage could occur. So I ended up having the catheter a little longer than usual. Now, I also was very anxious to get the catheter out. For me, it was extremely painful. Now, most men or women, they have no trouble with a catheter. They don't even know it's there. And some men I talked to really enjoyed it because they didn't have to get up to go to the bathroom. They thought it was great. But for me, it was brutally painful at the tip of my penis. And I think it may be because it was rubbing. And so I was very thankful for one of the nurses who looked after me in the hospital. I told her what my problem was, and she says, "Oh, I know exactly what to do." And she said, "I'll be right back." And she ran out of the room, and she came back with a tube of numbing jelly. And this is a miracle for me. You put a little bit on the area that's painful, and within 30 seconds, 40 seconds, the pain is gone. So I was so thankful and so happy and relieved. And no matter where I went with that catheter, I always had that tube in my pocket whenever I needed it. But most people don't have trouble like that. But so I was so anxious to get rid of it. And when the day came, I was off to the urologist's office, went in and lied down on the table. And he deflated the balloon that holds it in place in the bladder, and then he pulls it out, throws it in the bin. And I had to look down. I was a little worried about leakage and what things looked like. So you have to look. I mean, it's like, I'm looking, I'm a little nervous, and there was no leakage, like none. But I think that's because I was lying down and I wasn't moving. When I got up, there was a little bit of leakage and also burning sensation as well, which I wasn't expecting that. But I was very fortunate in that area. Every case is going to be different. It really depends on how far cancer is invaded, the treatment option of your choice and how well the treatment worked. So everyone's going to be different. But for me, my urinary control returned within 6 weeks, and it's been excellent. And as a matter of fact, it's even better than before, which is kind of unusual. My flow was a lot better. And earlier on in the video, I said that I didn't have any symptoms of any kind. Well, maybe I didn't have any symptoms that I recognized because my flow was so much better after my treatment that maybe my low flow was a symptom that I didn't recognize. And I think I probably wrote it off as I'm aging and never really thought about it. So that potentially could have been one of the reasons. So I was very fortunate in that area. Now, as far as the erectile dysfunction, that's a lot more of a challenge. My erections did return after about 3 months, but they were certainly very low quality and really, it took a long time. It took probably 17 months. And they're not as good as they used to be, and they're certainly not as spontaneous as they used to be before. It took no effort at all, and they were available whenever I wanted one. Even when I didn't want one, there was one there. But so, you know, I'm happy they're there, but they're certainly not anywhere near what they used to be. So I suppose here I am now, 4 years out, and I did have a little bit of a scare about recurrence. I do have a little bit of a fear of recurrence. At one of my PSA tests, I've been getting them every 3 months for the first 2 years, and then now it's every 6 months. At one of the ones, I've always been, ever since surgery, I've always been undetectable. And my measurement with the lab that I use is less than 0.008. So it's always been with that less than sign, 0.008, consistently. However, at one of my previous PSA tests, it came back without the missing sign. It came back as 0.008, and I kind of freaked out a little bit because I thought, well, it's now detectable because it doesn't have that less than sign on it. So again, I did a ton of research, and I talked to my doctor, my urologist. I even called the lab, talked to a biochemist who worked at the lab. And I discovered something interesting, and that is, I knew it was important that wherever lab that you use, to continue to use the same lab. And the reason why that's important is because your lab has the equipment that's set up for whatever sensitivity that they use. And if you go to a different lab, they might have different equipment, so the reading might be a little different. But I didn't realize that even at the same lab, you can have a slightly different number. Because they're measuring such low levels, there is a little bit of percentage of error. So I did have another PSA since then, and the minus sign, or the less than sign has returned. So I'm not too worried about it. We shouldn't be worried about it anyway until it's a much higher number. But so anyway, I feel good. My activity level is back the way it was before. Energy is good. I don't even feel like I've had treatment, other than the fact that my erections are not as good as they used to be. But other than that, I feel good. So I'm 4 years now since surgery. I may have covered everything. I'm here today to answer questions.
Can I ask a question?
Absolutely, please.
Yeah, okay. Can you tell us what your PSAs were prior to surgery? Like you gave the history, they kept going up and up and up, but what was the level? And also, I didn't hear that you got a biopsy at all. But if you did, what was your Gleason score? Please.
Oh yes, I had 2 prostate biopsies. Well, my first PSA reading was 4.1. Now, and then from there, it kept gradually rising. It was 4.3, 4.7, then hit 5, 5.1, and the highest it went to was 5.7. but it was always in the upward direction. It never went down. Now, the first time I had a prostate biopsy, it was a blind biopsy. Now, I didn't realize at the time it was blind. I didn't really know much about prostate biopsies. I didn't understand that when I had my first prostate biopsy, it came back negative. It said there was no cancer. But I didn't realize at the time that it's possible to have a tumor in there somewhere, because it's blind, it just missed it. And my cancer was in an area where cancer doesn't normally grow. So when they do the blind biopsy, they kind of target places where they suspect cancer might be. So mine was missed. And it wasn't until much later, 5 years later, as my PSA continued to rise, that my new urologist recommended that I have an MRI. And that highlighted this significant anomaly. So then I had another prostate biopsy, and they targeted that area, and it came back as Gleason 4 + 3 = 7. In all cases, they took six samples, and there was Gleason 4 + 3 in all 6. And of all the tissue that was taken out, over 50% of it was cancer. And it turned out that my tumor was the largest that my doctor had ever seen. It measured in at somewhere around 2 golf balls. And my prostate was also large. It was around 4.5 golf balls. And here I am with this huge tumor, and I had no symptoms no notable symptoms anyways. And it also was in stage T2C, which is the final stage before breaching. So most likely, if I had not been monitoring my PSA, I wouldn't have had an MRI, and my cancer most likely would have spread before I developed symptoms, which seems to be common, where symptoms are not usually there until after it's already spread.
Gogs, it's Bob here.
Hi, Bob.
Would you mind expanding on the article you wrote about coping with mechanism, or my coping with mechanism being the mental side of things? Because I find recently I'm getting more calls from men who are troubled by their thinking process and working that out.
Absolutely. Now, when I was first diagnosed, I said it was very devastating, which it is very, very devastating. I only thought about physical impacts. And all my research, I was totally focused on physical impacts. And even my healthcare team focused a lot on physical impacts. No one ever really mentioned to me, or I didn't really realize it at the time, that there would be emotional impacts as well, and mental impacts. And it was only until after my treatment, maybe a couple of years after, once I started meeting a lot of other men who had been also diagnosed with prostate cancer, that I started to develop a fear of recurrence. And it's that emotional support that was really lacking in the healthcare. Like it just wasn't offered. And when I said that when I was diagnosed, I went into shock. Probably at that time, that's when I needed this emotional support. Like rather than looking at treatment options, that it should be looking at my mental health first, getting me in a stable place before I move onward. So it's only something that I learned afterwards, and I'm learning that a lot of men are also facing a lot of mental issues. Like even mental impacts could be even worse than the physical side effects.
Okay.
So it's so important, yeah.
We had indicated we weren't going to ask questions because of confidentiality, but so far the questions I don't think are that confidentiality. I have a few other questions that your answers may be of interest to the people attending here. I'm wondering, when your doctor was checking, doing a digital test, she didn't feel any lumps, it felt soft, and yet you say your prostate was enlarged. So how come she didn't detect that?
Well, she did mention it was enlarged. All the doctors who did a digital rectal exam, they did tell me that my prostate was enlarged, but they wrote it off as typical, and it is typical. As men age, prostates also tend to grow as well. So they were more focused on the feel of it as opposed to how large it was. and I guess it wasn't on anyone's radar that the tumor was outside the reach in an area where it rarely grows.
Another question is to do with the type of surgery you had. Did you look at others? Did you have an open radical surgery, or was it laparoscopic?
I had an open prostatectomy, and the reason why I did that was I was aware of the laparoscopic, and I was aware of robotic, and I'm a big technology fan. So I love the idea of robotics and technology supporting, absolutely. Especially with robotic, you get the magnification, and it was quite fascinating when I did my research. But what had happened for me anyway is I developed such a good rapport with my urologist that I really trusted him. And he was been doing open his whole career, and he had a number under his belt and a number of success under his belt, and it's only because I trusted him. If I didn't really have that rapport, then but you know what? Even though I trusted him, that's not good enough to make a decision. Really, I should have taken that time to talk to another urologist, a robotic urologist, and even if for me, even if my urologist turned out to be the best for me, I still need, like, how do I know he's the best for me unless I shop around a little bit? And so again, I think I did trust him, and I'm quite fortunate that things did work out for me, but I don't want to be in the position of just being lucky. If I had done my homework, and if I spoke to other doctors, and I kept that open mind, and then if I went to surgery, and then if I used my same urologist and my treatment failed, at least I would have taken comfort in knowing that I did my homework and I made the best decision that I could, rather than just hoping that it worked out. So open.
Right. During my decision process, my first urologist, I didn't have that confidence that you had. So I searched out robotic and also laparoscopic. And in my thought process was laparoscopic and robotic was way more advanced technology-wise.
Oh, absolutely, yeah.
And I'm going, the open radical surgery is, old school. However, in talking to men through the past years, I've come to the conclusion, if your urologist is well and experienced in doing open surgery, the success rate is same, if almost concluded, maybe a little better in results than laparoscopic or robotic. So from my perspective, if you get the right doctor and he's got the experience, it doesn't matter what you do, what you decide on, your results are going to be almost parallel.
Yeah, that's totally accurate. I really like the way you summed that up, because it's so important that, like, if you're trained in a certain field and that's what you've done and you're an expert at it, then you're good at it. I'm sure the new guys that are in school, or the new ladies in school, they're learning all the latest stuff, and they're going to be great at that because that's what they're trained on. Yeah.
Another thing I like it when you emphasized when the doctor says, I want you to rest and take good care and not lift anything for 6 weeks, that you follow that to a T, because I violated that as well as you did. And when I came home, I felt so great. We have a set of stairs in the house, and I was going up and down them and figuring I was getting some decent exercise and no stress physically. However, it was like the third night, all of a sudden I was awake in the middle of the night and I had this huge swollen penis. It scared the daylights out of me and my wife, who was a nurse. and you couldn't call anybody at the time, which I know you can call people now. But it came down that I over-exercised and caused some disturbance, and the swelling occurred. So I thought this was great. The erection wasn't supposed to come back for weeks or months, and I'm looking down on this thing. This is big now, and I'm ahead of the game, but wasn't the case. One other thing, when you talk about erections, do you use any assistance like Viagra or anything, or is just a normal what you're talking about?
No, I do. I didn't, at first I didn't, but they did start to return around 3 months. As I said, very poor quality and maybe just a tiny bit. But then that's when I talked to my doctor about it, and she gave me a prescription for Viagra. And so I started taking a low dose of that every day, and then every once in a while take a full dose. And then it took a long time. I was 17 months later. So, and also with the pill, it's not a magic pill, unfortunately. If you take it and just wait for it to happen, nothing's going to happen. There's a lot of things that need to take place. And one thing that I found is I need to spend a lot more time on romance and foreplay before I didn't require any of that. But now my partner appreciates that much more, because now you need to have a romantic evening with dinner and things may or may not happen, but you get a nice evening out of it. But yeah, so I when you take it, you gotta work on it.
Right, that's been stressed with the clinicians that are specialized in sexual thing, is that the pill isn't the magic thing, it's the intimacy and everything else that you have to entice yourself to the sexual experience.
Absolutely, it makes such a big difference, like, especially if you can get your spouse or your partner, if you're able to get them into the mood, then that helps your mood.
Right.
Yeah.
Is there any other questions for Gogs? Has anybody come up with any other questions?
I have a question. On the biopsy and your Gleason 4+3, I had 7 as well, but it was 3+4, which they said wasn't as bad as 4+3. But did you get the Gleason score on the lab analysis after they had removed the prostate? Was it still the same, or?
Yes, it was still the same. Yeah. So that would indicate to me that the prostate biopsy hit the hit the same Gleason score as, I guess in the lab what they do is they measure your prostate and they slice it up, and then they but it came back the same, 4+3.
See, mine came back it changed from 3+4 to 4+3.
Oh, okay. So that would indicate that the prostate biopsy didn't hit the 4+3.
Yeah.
So that's something else I kind of assumed is, you may have a larger tumor or a more advanced tumor, but the biopsy hit the less advanced tumor. It's like, that's why I'm a big fan of MRI, to get hopefully get a better picture of what they're targeting. Huh.
I have another question. It's not directly related to you. The recurrence, I have biochemical recurrence. Oh, I've lost the train. I've lost my train of thought. Sorry. That's gone. Sorry.
No, that's okay.
But we'll follow one other thing. Bob, when we had Dr. Crook on, somebody asked the question about biochemical recurrence, anything over 0.2, and she said that's rated as failure. Does that mean the surgeon failed in getting it all? Or what exactly does the failure mean?
Ron, maybe you could answer that question.
They generally wait, it's a few years out, and if there's been a rise of the pH of the number of what you spoke about, they do indicate that something is causing it. And it may not necessarily be cancer, but something is causing a reoccurrence. It doesn't mean that a person or procedure has failed. It could be a brand new tumor that has started. So it's kind of vague. So I wouldn't say, gee, the surgeon failed or the radiation failed. In my case, I had a very small tumor, and I was considering a trial procedure that was being done in Toronto that used an MRI and laser abatement. But then when I went for the second test of the trial, another tumor had started. So I was not allowed into this trial period because I had another tumor going. So the doctor at that point said to me, Ron, you really got to think about killing the whole prostate, because you don't have one tumor, you have now a two, and there still might be a third that could start. So again, it's not necessarily they didn't get all the cancer, they maybe didn't get all of the prostate tissue, and some of that tissue now is becoming cancer. So there's a variety of reasons that can cause it. So it's a failure, that is the term that they use, but not necessarily failure of the surgeon or the procedure, etc. They failed to stop the cancer.
Thanks, Ron.
Okay, any more questions?
Hello, can you hear me?
Yes?
Okay, you read a lot of books on that. Did you alter your diet or nutrition? What did you do different? Or did you drink liquor too?
I didn't really alter my diet. My diet wasn't the healthiest, but I didn't really do anything differently other than try not to overeat, and try just the basics, cut sugar and cut the sweets, which I still struggle with. For me, it's I grew up on sweets, and maybe I use it as an excuse, I guess, because it reminds me of the old days. But no, I didn't really change my diet that much. Just try to be more cautious of what I'm eating, because I did notice that when I'm eating, I'm not really thinking about it. And now when I eat, I try to catch myself to think about it first. Yeah, so no, I didn't really make much changes other than trying not to overeat, as I used to do quite a bit.
Gogs, I got another question. We've heard your story about cancer. Could you relate to us your decision and experience in writing your book?
Well, I tell you, when I was first diagnosed, I had no plans to write a book. I had no plans to even talk about it. I didn't even want to share it with my spouse. I had all kinds of emotions. I was scared, and I was also embarrassed. I thought maybe that this was my fault, maybe something I did in the past, my lifestyle, and I really didn't want anybody to know. And so it took a long time to really talk about it with my spouse. Was very supportive, and she encouraged me to open up a bit, and it took a while, but what I decided to do was just to write a journal, and it was going to be a private journal. I had no intention of sharing it with anyone. It was just very simple at first, my doctor's appointments and test results and how I was feeling at the time. And what had happened is a few of my coworkers, friends and family, they would reach out to ask, how I was doing. And so I decided to share some of my private journals with them, and the response was quite overwhelming. They were very intrigued with my writing, and they wanted me to continue. So I got the idea, well, maybe I'll write a book, but I didn't really know what I was getting myself into, because it was certainly a lot more work than I had realized. But it turned out to be a real passion, a real labor of love, and I really didn't expect it to go anywhere. It was really just for me, and I thought maybe I'll have something I can pass down to the kids, and they can read about their dad. But it turned out that it was incredibly therapeutic to get all my thoughts out on paper. And I certainly recommend writing as a way to, as a coping mechanism. What we were saying before is we're all going to deal with mental stress of, in life in general, and a cancer diagnosis is very devastating. For me, we need to find healthy ways to cope with that. And for me, writing it really helped me a lot. So after 2 years of of writing, well, maybe 2.5 years, basically, I'm quite surprised at the feedback. I had no idea when I got it published that it would even, a few people might read it, but I've had messages from like different countries around the world, as far as Sweden and Switzerland and England and even Nigeria. There's a urology hospital in Nigeria that has the book in their library. It's in a few libraries in Australia, in the States, and there's a few libraries. It's going across Canada and a few libraries as well. And then I was quite humbled and blessed to hear from the foundation that they liked my book, and they passed it by Dr. Cox, and they thought it would be a great read for others going through who have been diagnosed. So I'm quite humbled and overwhelmed and blessed.
I know you've received comments from different countries in that they have never read a book or a story that has been so personal and explaining the details of what you went through. So great that you could turn your thoughts into writing and pass that on to thousands of men.
Thank you. When I decided to write, I wanted to make sure that it was a complete experience and completely uncensored, and I wanted it to be medically accurate as well. So I really hung on every single word. I probably spent a lot more time writing than I guess normally, because I was so making sure that it was complete and accurate and heartfelt.
You hear stories of people doing their first book. It's the experience of securing a publisher and reviewing and documenting all the stuff and getting it put down on paper. It's a whole new experience.
It's a big undertaking, and when I first gave my book to the publisher in Vancouver, when they read it, they said that it was a good start. And I thought, what? I'm done. So there was they had a lot of good suggestions, and especially around if there was anything that I would have done differently. And so I had thought about that, because that was a great question to ask me. Is there anything you would have done differently if you had to go through this experience again? And I came up with at least 30 different things that I would have done differently, and I put all that in the book as well.
Cogs, we'd like to take this time to thank you. Your presentation was exceptional, and those that have gone through the journey, we relived it with you again. Those that are in the process of deciding on treatment, this was, I'm sure, a very informative presentation that Cox gave you. So once again, Cox, many thanks. We look forward to seeing you again, and hopefully we'll be reading your second book. Thank you.
Thank you very much. Thank you for having me.